Okay, hi everyone. I'm Joy Rosa with Earthworks Acupuncture, and we're here today with licensed acupuncturist Carlos Cruz of Restructured Health. And Carlos is also a licensed massage therapist since 2014 and has served in the United States Army as a medic. Welcome, Carlos.
Hello.
Hey, so introduce yourself a little bit more and tell us where you're located. And
Yeah, like you said, I was in the Army for 8 years. Again, my name is Carlos Cruz. 8 years in the Army, 2014, I got out and I became a I was an occupational therapy assistant at the time. I became a massage therapist in 2014. And then through that, learned about structural integration. So most people have heard of Rolfing or Hello work. So my school was Soma, the Soma Institute in Buckley, Washington. And I still wanted to do something else to be my own provider. As a massage therapist, you kind of are, you're your own provider, but I can't see as much people as I would want to. They're not seen as exemplary of the medical field. So I kind of wanted something a little more. And OT and PT, I kind of got burned out as soon as I got in the Army, or out of the Army. I worked in some skilled nursing facilities, and it was a little too much for me.
mm-hmm.
My whole thing about massage too was I wanted to work with people who wanted help, and those kind of fields, especially if you work in skilled nursing facilities, people are just there, and you kind of have to hunt them down. And where I felt massage in that part would they were coming to me. So kind of the first part of, I think, healing is you kind of want to be healed. So I felt that massage had that part, but it didn't have, I want something a little more. So I started looking in the other fields. Again, PT and OT were the ones that I've already studied. So I looked at that, and then actually in my structural integration school, I met another fellow veteran who had also went through acupuncture, and acupuncture had been kind of on the back of my thoughts. And really it was because he had told me that I could use my GI Bill to do both programs. And so I didn't even know that was a possibility. So I've come to find out that I could do that. So at that point I was living in Washington in Carnation, which is kind of east of Redmond, Bellevue area. And after that, I kind of finished my program, or I made my move to come down here to Vancouver. And I started working through the structural integration program, did structural integration, applied to OCOM, Oregon College of Oriental Medicine. And yeah, so I did the 3-year program, finished that, and this last year got my license as an acupuncturist as well.
Yay! Congratulations.
Been kind of culminating, working both of them together.
That's wonderful. For those who have not heard of Soma or Rolfing, could you just maybe briefly unpack those just a little for folks who might be their first time?
So Ida Rolf started structural integration. She started the Guild of Structural Integration, and then it kind of branched off into a bunch of different names. But basically, her program was they call it like a recipe. So you go to a regular massage therapist, and they go and you want to help with back pain or something. They will usually work on your back, or they'll hit the area that you're complaining about. Where Ida created this flow, this recipe that kind of broke the body down into pieces. So depending on where the practitioner trained, it's anywhere from 10 to 12 sessions. So you would go and see that provider, and we're kind of unfolding the body, working on different segments. And through those 12, you are, in a sense, rebalancing the body, or that is the and actually, if people look up Rolfing, their kind of insignia is this person made of blocks. And like, first part is like they're not lined up, and then the second block, everything's kind of aligned, and that's kind of the essence, I think, of what they're trying to do. So basically, yeah, rebalancing the body.
Okay. And is that different from Soma? Like when I think of Soma, I think of somatic. So does that have anything to do with like how your body is expressing emotions or anything? Like,
Yeah.
is it related to somatotherapy?
So yeah, Soma was, like I said, after Ida passed, some of her students kind of broke off and they started adding their own little pieces
Okay.
to structural integration. And mine was in Buckley, Washington. And ours, we actually take that original 10 series session, and we added an arm session. So mine's 11. And then along with that, yeah, they look at, it's not only the body, but there is the mind and the spirit aspect of it. And so actually in a true Soma session in the beginning of the series, you not only fill out this whole questionnaire, but you draw a picture of what you feel in your body. And then it's actually kind of a cool thing you from the beginning to the end, and then you draw a picture at the end. And you can usually see, not only we take pictures of the body from the beginning and the end as well, like your actual structure, but then a picture of what the person feels like. So kind of embodies this kind of aspect of, I guess, the Soma. And I guess that's probably why they came up with that name. But
Very cool. And I love that your structural integration led you to talking with other veterans who had, one, I think it's very important to highlight that you can use a GI Bill to go to school, like to higher educational schools like this.
yeah.
I think that's really important. And two, I was wondering if you actually like maybe, I don't know if you promote yourself in this way, but do you see a lot of veterans? I mean, I'm sure there might be many, especially in this part of the country, that might benefit with their PTSD from seeing somebody like you.
Well, as I just got out, I'm kind of working that whole system and trying to get my accreditation to all the insurance companies. But the VA, it is accredited, and they do see. And the clinic that I just started in, I have my own clinic, Restructured Health, but I also work in another clinic in Hillsborough. And that clinic, yes, we see a lot of veterans. Good. But, for insurance purposes, usually, as you might know, it's mostly out of pain. So actual physical pain. They're not going to see people for the mental aspect, although those two are highly connected. So yes, be dealing with it. But to see an acupuncturist, at least for the VA concerns, I think that has to be the main part. You have to have a complaint of pain.
Totally. Can you also go into a little bit about your own ancestry or where you're from? And do you practice bilingually?
It's funny. It's like I recently started in this other clinic, and I guess in a way I've kind of been the Hispanic speaking person, and it just brought me a little more practice. I kind of had the rule growing up. I only speak Spanish with people who don't speak English, because like my grandma, which would be the only person that I would speak Spanish to. But now that I work in a health profession, and in this last month or two before this whole coronavirus thing started, I was working in this clinic, and the front desk really started giving me a lot of Spanish speaking people, and it's been kind of hilarious. Like I walk in, and I know they speak Spanish because you get their intake and everything. So I walk in, and hola, ¿cómo estás? And they would brighten. Oh, thank God.
Yeah, that's very important. And you're from
I'm from Panama, and I was born in Panama. My dad is Puerto Rican.
Okay.
And Panamanian. So I was kind of looking at that yesterday. So I guess I got the Taino, and the mom's side. My mom's very light skinned, aspect of the Central American heritage, and then my dad is very he's kind of like mine, skin color, brown, but my family on my dad's side is very dark skinned. So I'm guessing I got that African African aspect there. So, but yeah, dual Hispanic. But I was born in Panama, but we moved here pretty young. So I've lived in the United States most of my life. I have dual citizenship in Panama.
Oh, awesome.
So because I was born there in a American hospital.
Yeah.
Before the army shut down all their stuff there. But yeah.
Do you think you'd ever practice in Panama?
I don't know, with all this craziness happening, that would be something in the end. Yeah, maybe like when I retire or something.
Yeah.
It is kind of like how it is in the Pacific Northwest.
Yeah. So I'm wondering too, while we're living in the Pacific Northwest, like what ways are you providing care for yourself? Like for self-care as a practitioner, as a provider? And are they different than, say, advice you would give to your patients?
And we'll probably get into that in a minute, but mostly I find myself as a Chinese medicine practitioner, I'm really, or my niche is sports medicine. So, and that's where I go. And before I graduated in this last year, I actually fell into another modality called functional range conditioning, which is kind of joint training. And I think that, along with other stuff that I do from Chinese medicine or Japanese style that I practice, like Moxa, and sometimes needling yourself in, at least what I was taught in TCM, traditional Chinese medicine, is kind of frowned upon, or people say it is, where in the Japanese style of things, they kind of have the opposite idea, where if the practitioner doesn't treat himself, then how could they
know how to
treat another patient, And so I take herbs every day, and I needle myself. I do Moxa, Okyu Moxa, which is a more Japanese style, where you actually are putting Moxa directly onto the skin. And we can go into that a little bit more, but those would probably be, with all those modalities, is probably what I do for self-care, along with like just exercise to complement my favorite thing to do, which is jujitsu.
Nice.
And right now it's pretty much just kettlebells. And right now, most of my exercise is trying to keep my sanity with these kids. And so lots of walks and short little meditations, or little short workouts.
That's good. That's good. So how has COVID-19 pandemic impacted your business? And what are you doing to supplement, if anything?
My business, I am not working. So I actually got sick. I don't know if it was COVID. I got a flu. It was a pretty bad flu. My suspicion might have got it. I have no idea. I have not been treated, I've been treating myself, with herb. And it kind of ran through the house. And that kind of the last week, it was March 15th, is when I got sick. So kind of a really bad flu. Kind of probably the worst that I've had, where I got some weird achiness, like real soreness that I never had before. But that kind of ran its course. And since then, I haven't been to work so I got sick, and then that lasted like a week. And then right after that, that's kind of when Oregon shut down.
Right.
So all medical providers, so massage and acupuncture weren't supposed to be seeing people with non-emergent. So both my clinics decided to shut down. So right now, looking at probably June, that I'm going to be able to work in acupuncture if they don't move it anymore.
Right. Yeah.
So I haven't done anything right now. Luckily, I am a disabled veteran, so that is kind of where I'm getting most of my things. And before everything kind of went hairy, we kind of got our supplies, so we have enough, I think, to get us through the winter, as it were.
Yeah, you're prepared. So in response to the pandemic, we're seeing a lot of reports about Chinese medicine and herbal formulas. But can you go in a little further about Japanese techniques? You were mentioning Moxa, and like how they could also play an integral role in bouncing back from this after the pandemic.
Bouncing back, the Japanese, if you're not aware, in Japan, acupuncture is its own thing, and herbal medicine is actually practiced by medical doctors. So an acupuncturist cannot prescribe herbs in Japan. And they actually have Moxa therapists too. So I think that an acupuncturist can do Moxa, but you can only go and see somebody for Moxa itself, just by itself. So they actually have separate certification.
Wow, I didn't know that.
So there's 3 kind of different modalities there. But in Japan, yeah, the acupuncturists don't practice herbs.
Huh.
So as far as that respect, yeah, you're probably not going to get any herbal medicine. But one of the big things in the lineages that I've learned in Japanese acupuncture is the stomach chi. So kind of like the force that keeps things moving in the body. And it's one of the masters that I'm learning from. His master, his dying words was check the stomach chi. So that is like the big and that integral part of my practice. And there's different ways to do that along with the needle. But like I said, I do Moxa myself, so Oku Moxa. So there's a couple points that are particular for the immune system.
Can you also name the lineages or the master teachers that you've been learning from? I'll link them too in the description, but just for vocal.
My predominantly there's a bunch of different lineages in Japanese acupuncture. The one that I have been studying and practicing the most is a Nagano-based lineage. Mm-hmm. He was a blind acupuncturist, and in Japan, like I'm not very sure on this, but my idea has been that acupuncturist massage therapists were like the jobs of the blind.
Right. Lots of palpating, so yeah. Makes sense.
So he created this certain style. He went through his like practice. He created certain things that he liked to do, and so the ones that I've studied, his people that came out of his lineage were Kiko Matsumoto, which is kind of more famous here in the States, and then the other gentleman, which was his last student, was Shimomura.
Okay.
And for me, and this is just my opinion, I find like Shimomura Sensei's method is particularly well for physical pain or like physical medicine, and I use kind of Kiko more as like the internal medicine. So. Okay,
so is that kind of what you're working with? Well, even though you're not in practice, but I'm sure you're still reading and learning these things, but the Japanese practitioners and theories behind them, maybe you would say Kiko Matsumoto's internal medicine would be what pertains to coronavirus, or like what are you reading?
I would not put those like close. You can like Western medicine and East Asian medicine aren't, to me personally, are not the same.
Yeah.
So you're working on different aspects. You're comparing apples to oranges.
Right.
From my belief and my idea is like, especially in the Japanese acupuncture, we're trying to strengthen the body. When the body is able to work at its full potential, it can do what it's supposed to do and keep everything healthy. So in regards to pain, you get kind of signals that are in the way. So like the pain signals are going through the body, and now because something's bothering you or the inflammation or whatever you want to call it, it's kind of in the way. And one of the practitioners that I work with, she kind of says, we're clearing out the muck. We're clearing out the garbage in the way and helping the body think. And all Chinese medicine, Japanese acupuncture, any acupuncture, I think they all work the same. For me, it's just Japanese style is a little more precise in the way you are looking at the diagnostics. It's very palpatory based, hence it being with blind acupuncturists. And I think that's why it kind of, I found my niche with it, is it had like 7-8 years of bodywork, hand knowledge, outpatient skills.
Yeah.
So it melded with me a little bit easier. And I actually found it in during school. We were working, and I heard this was Japanese acupuncture, and I kind of like brushed it off, like whatever. Okay. And then I actually I saw one of the sessions in progress, and so it's like, and I saw how it helped, and I went to read up more on it, and I actually got one of the Kiko books, and she broke it down, her ideas in, she called them 11 constitutional deficiencies.
Mm.
And one of those deficiencies was structural imbalance. So that kind of shined with me, being a structural engineer. I think that from there, I kind of started working in it. And anything that I do because it's kind of selfish. Everything that I've gone into is I want to help myself.
Right.
So a lot of the things that I've done, I try it on myself first.
Right.
So all the herbs that I do, all the modalities that I use, I've had it firsthand. It's an N equals 1 experiment, and I'm usually the first one to try. So
yeah.
And I believe in it because it's worked on me, and or I've seen it work on people that I've worked with. And for this style, that's what I've seen. I've seen it at least in the pain management perspective and body pain and healing, like musculoskeletal issues. I've seen it work very fast. Get good progress in one session, and I think that's why I stayed with it.
Yeah, I think that's great. And there's a really prolific Black writer, Audre Lorde, who mentioned that self-care isn't selfish. It's an act of self-preservation. And I think that that's really important because oftentimes, I was in school with you too, but like you're kind of, well, we'll say like patient. You're your own patient, basically, so I think that that's really important. And speaking of self-care and like how the stomach chi is so vital, like that's, if I understand this correctly, in the Japanese lineages, the stomach chi is kind of the pinnacle of like what you're working around.
Honestly, in the Japanese lineages, it's more this particular style. That's what he focuses on. That's one of the big. Kiko was another one of his students, and what I said with structural imbalance is one of those 11 constitutional deficiencies. Stomach chi is like the first one. That's so. By working on that, you're kind of enlivening the body with
right.
The energy.
And in your understanding, because you're now using Japanese and Chinese modalities, depending on your patient. I don't know if there's crossover like this, but like in Chinese medicine, right, the spleen and the stomach are vital for blood production and also further along, the metabolic way, not only blood production, but wei qi or immunity. So is there some kind of connection with this in Japanese medicine?
Well, it's not different. If anything, I feel all the TCM history and all the science, not science, but the theory is there. Same theory as you learned. They just continued on in certain aspects, and certain things different, or just the points they use
I see.
are a little bit different, but the theory is all the same. And yeah, but it just kind of depends. So in Kiko's style, she correlates the lung with, she calls it the immune. So if another difference between a TCM style and a Japanese style is the use of the hara, or the abdomen. And so when I'm palpating, I'm also palpating the body, the skin, looking at everything along with most what a Chinese therapist would see, a Chinese medicine practitioner would see. But there's actual things that feeling on someone's abdomen can show you, and there's certain aspects that are, they correlate to different of the TCM organs. So the immune would be that aspect, and you can actually, people start getting a little sore behind. Well, so that's another kind of reflex that we are looking for. So it's just there are more clues. You're a little more of a detective, and I can. It's kind of you can find things to back up your theory.
Yeah. Observation is really important. It's one of the main diagnostic tools that we have in practicing this medicine. That's really good. Can you give us a little bit of an understanding through a Japanese lens, like why Moxa is important, or maybe like what foods, do they have like nutritional therapy as well? just kind of thinking about at-home care during quarantine and kind of what people may have access to. Not everybody has access to Moxa, but people might have access to things like ginger.
Yeah. Yeah. I mean, I don't think it'd be any different than what you would learn in TCM.
Okay.
But yeah, in Japan, the okyu that maybe we do, or sorry, the moxa, okyu moxa that we do to our patients, like say in clinic, over there is my understanding that the therapist gives it to the client, to the patient, and they're doing it at home. So the patient's actually learning how to do moxa themselves. So over there, you're going to put the moxa on your skin and light it yourself, and they're going to do it at home.
There's a lot of liability here.
Yeah, but they're doing their treatment, so that's the way they would be able to continue the moxa. And for me, there's a book, The Moon over Matsushima, I believe, and he talks about kind of the history of moxa busting and how Japan kind of took it a little further. But the use of the moxa in that book was really interesting because they talked about how there was a lot of lost teachings. There was a lot of scrolls that were lost. And as we know, like, you know, you have the 365 plus acupuncture points. Well, there might have been like a whole system of moxa busting, and moxa busting probably would have been the one that was there first. So some points that we use in acupuncture are sometimes better as moxa points, or vice versa, or both together. And Kiko actually uses some points together. So in that book, they talked about, it's actually a lot of in science, and I usually tell people I forget what it's called. The infrared, when you get an infrared.
Like the light therapy?
Heat shock proteins. You get a heat shock protein from one of the points. So it's like, say, if you go through in a sauna, and you're getting the heat, that creates an effect from the heat shock proteins in your body that kind of reduces inflammation. And what the guys are saying about this in the moxa is there's kind of 3 different things that are getting affected when you are doing something on a point. So when you stimulate the point with the needle, it's one effect on your brain. And with the moxa, it's having another effect. So you're kind of getting the system, the immune response, from 2 different triggers. So kind of hitting it from 2 different ways. And I think that's where moxa is having its effect, or one of the ways.
Yeah. That's awesome. Really good to know. Are you giving any advice to your patients, like for at-home care right now? Like, again, since people can't use Moxa and you're a structural integrational therapist, so.
My advice is probably going to usually be with the physical medicine aspect of it, or the functional range conditioning, and that would be the controlled articular rotations, or the CARs. So if people look up FRC and CARs, you can usually find, they call the morning routine, and it's basically a good full body movement exercise to keep all the joints in motion and keep your range of motion in the body that you had. And they call it a morning routine because they usually want people to do it as soon as they wake up.
Okay.
So especially if you have an issue anywhere, pain, it is the idea of the functional range conditioning that there's a reason for pain, and it usually has to do with one of these main joints. And most people have pain in like most of the main joints. So the big ones are like the knees, the hips, shoulders. So if you want a joint to stay healthy, it's going to be through movement. And that's where these exercises are using full range of motion as much as possible. And kind of like the big ones. So if people are going to look those up, it's FRC morning routine. And then kind of the big ones that I usually, or the big rules that I usually give my patients is kind of when you're doing them to, number 1, only to focus on the joint that we're working on. So trying as best to move my shoulders. So if I'm doing my neck CARs, for instance, I'm trying to move my whole neck through its entire range of motion
Mm-hmm.
and not moving the rest of my body. So only the neck. So I'm looking over here and not moving my shoulder.
Right.
So trying to get as much input as I can in that joint as I can. And
Yeah.
then not moving into pain. So if I move into pain, using that as your range of motion. So,
Mm-hmm.
so only going as far as pain allows.
Yeah. Those are
And that
great tips.
keep that joint kind of healthy, lubricated.
Those are great tips. And I really do think that, the more information that we put out about this, like a lot of our frontline healthcare workers are just like working tirelessly around the clock. And I think the more information that we put out about our services in preventative healthcare are going to help alleviate things like this down the line. Like, this isn't the first pandemic, it's not the last pandemic, unfortunately. So the more information that we can get out to the general public about why this is so important is really, really helpful. So I really we're kind of coming to a close, but just thank you again for being on here and just kind of enlightening people with what you do and what resonates with you in terms of Japanese acupuncture. One more question. I'm wanting to know what books you might currently be reading or would recommend to folks at home, just about even if it's like something that you really enjoy other than Japanese acupuncture.
Man, I'm more of a podcast person, honestly.
Oh, okay. Yeah. Podcasts are great too.
And it's just been like listening to all the stuff on the COVID.
Yeah.
Joe podcast is the one that I've been kind of going through.
Which one?
Joe Rogan.
Okay.
And honestly, my days have been inundated with dealing with my children. And,
Yeah.
it's been a mama appreciation coronavirus epidemic for me. I can see what my wife goes through every day with my 5.
Yes.
That, I think the biggest thing I've been doing is getting a lot of cooking shows in. And my cooking skills are getting
Yay.
time. So if I was to recommend one, it's Good Eats.
Good Eats. Okay.
Good Eats Reloaded. I'm going through that whole little spiel. Keep buying things from my kitchen now, making everything fresh. It's a bibimbap the other day, and
Oh, okay.
some pupusas.
That's awesome. Great. Well, I'll link those, and I'll also link the moon over Matsushima.
It's a book for if anybody's interested in the history and lineages of the Moxa.
I know I am. I think that's incredible. Well, thank you, Carlos. And if you ever want to come back on here and, go through like a small structural integration routine or something, you're more than welcome to come back. But we're going to come to a close. I'll link all your linkables and y'all check out Restructured Integration. And we'll talk soon.
Yeah, thank you.
Thanks.